Part of the debate in Congress is going to be about something called what public option is going to exist in this hybrid that's being created out there. And many of us believe single payer is the way to go. The issue is going to become, if that's going to be the path that we don't go on, then what are we going to institutionalize in this in terms of a public option? And many of us feel that it has to be robust, that it has to have Medicare as its provider network, that it can't have a trigger that effectively dooms it, that it must be competitive, and that it provide consumers a choice, and that regardless there'll be some universal understanding, no denial for anybody, whether you're a private or public provider of pre-existing conditions. That everyone must not deny services and attention based on a pre-existing condition. Part of the discussion is going to be cost, where it comes from, how long-term is this cost going to be, and I think that's going to be the hardest hurdle that we have, and how to pay for it, and beyond paying for it, how to make sure that after a 10-year period that we have not created further debt for ourselves and for the next generation, i.e. Medicare, i.e. Medicare reimbursement needs to go up, Medicaid reimbursement needs to go up as part of this plan. And so we have a handful of very, very important issues, the political debate, and I think essential debate about what the public's role is going to be in this reform package, the essential and necessary role about how it's going to pay for it and what it's going to cost, and the issue of universality that was bringing. I think if you approach this discussion with the understanding that at some point healthcare to the American people has got not only be accessible, but an automatic. That the American people have the ability to feel secure about that aspect of their life. And right now, when 1 out of every $5 is being spent on healthcare costs, and projected by 2050 to be 1 out of 3 if nothing else changes, we also have a cost containment issue that I think is very, very critical to this discussion. So the debate is just beginning. But the parts of it that are essential for us are in front of us. The public option, public insurance, what that is and what it means, how we are going to strengthen the role for long-term care and older Americans in this health reform package, how we strengthen the role for children and infants in this package, and how we look at the provider network, making sure everybody is at the table. Hospital providers, docs, consumers, the government, private insurance, all at the table, with each having some say in the deliberations. And no one necessarily having full veto power over a concept. And I think that's going to be the politically tricky and difficult stage that we're going to go through. Other issues to include in the healthcare reform is going to be to allow Medicare to negotiate in bulk for discounts in pharmaceuticals. We're going to look at how we subsidize private insurance companies, reevaluate that, and see that as a source of revenue to be able to do other parts of the plan. There's a discussion on an idea that I really like, and that's to allow early retirees to purchase Medicare coverage. Many of the 5.5 million Americans between the ages of 55 and 64 lack any kind of insurance. So create that public option where you can buy in. And on any option, it's opt-in and opt-out, which means no one is forced into a system, but you do have a choice. And I think by having a robust, energized public option, that you have let the marketplace play its role. Now private insurances have significant competition. And I think if that is played right, it'll drive costs down for everybody, if it's played right. I'm looking forward to this. After all, I'm a masochist, so it should be fun. I'm looking forward to this, and we're going to do more of these. We're going to have a rally on the 11th to deal with healthcare, to deal with the public option. I think it's going to be at the community center, 11 o'clock, I think. That just got settled today. And we want to, at least in the district I represent, fully energize and engage the people here, because you know what? Of all the domestic decisions we're making, healthcare reform has the greatest implications, the greatest consequences, and also the greatest opportunity to do something right here. And so we want to hear all the way through. We just finished meeting with some talking about trauma units and the need for emergency room coverage, care that is not paid for. How do we deal with that? So we go on and on and on. But the only way we're going to come up with a package that resembles what America wants is to listen to them. And this is our beginning of this process. And so the leadership has some real ambitious dates. Get it done by July. I don't think so. I think this is going to be a much, much more deliberate and painful process. But it should be that way. This should not be something that we shut our eyes and then worry about details after the fact. We need to know the details now, the implications of that decision, and then go forward. But, so thank you very much for being here. We have an outstanding panel. We're all prepared to learn from them, and I want to thank them once again for being here. Thank you very much.